Hi, good afternoon, everyone. I am Dr. Ajantha. I'm a pediatrician practicing in the private sector. These days, most of you all are at home, and you all have to um, manage your home chores and make sure that your children, especially, and the loved ones are free of infections. Um, Basically, today's live video is to look at health tips on personal hygiene. And basically, we will look at the home-based care, what you can do at home, what you can do with your newborns and infants, how we would like to manage to make sure that things are under control as far as personal hygiene goes. Right. If we take parents, young parents especially, prepare themselves well ahead before the newborn arrives, and especially at the home front, making sure that things are under control with the separate the room where the mother and the baby is going to use, and things are bought in brand new and things are very good, and we try to manage how things should be. Right, few things on those lines. One, when we say home-based care, the room environment. I always make this comment. You should never be industrially sterile, but you should be clean. So we, as young parents, people tend to use a lot of strong detergents, strong antiseptics to clean up the place. And our advice to you is don't try to be industrially sterile, but be clean. So mopping and cleaning up, using a soap-based detergent may be useful to clean up things and making sure things are okay. Clothing which are washed, basically people tend to use detergents and also sometimes things like cetrimide, that is Savlon in I would say the normal layman's terminology. You don't really need all of them, but still you can use them if needed to, and make sure that you iron the clothes, especially the newborn's clothes, iron well with a dry iron so that you get rid of most of the bacteria and viruses which may tend to wither on, and even the fungal growths can be controlled. Right. So when we take the room environment, you need to look at two aspects. One is infections and the other allergens. So when we look at infections, as I told you, mopping and cleaning helps. You need to have a nuclear care. What we call nuclear care is, say, not more than two people involved with the care of the newborn at home, solely because you tend to, when multiple people are involved, then cross-infection is high on the cards, and we prefer few people to be involved, especially the mother and the mother's mother, or the caregiver has a supportive staff, say one more person, 2 to 3 people maximum involved in looking after the newborn. So, and also, for example, simple things like giving a bath to the newborn. Nowadays, people have a lot of geysers fixed in their houses, water heaters, which they use the hot water to bathe the baby. Very important. One of the important facts is babies tend to drink the water when they are being given a bath. So I think you are safer using boiled warm water, which simmers down to the normal body temperature and given a bath, than using water direct from the geyser. The tendency is our pipelines don't have, compatible clean water, so we are in more trouble when we tend to use geyser water or waters of hot water or water heaters. Very important, say that so that you maintain cleanliness and sterility as far as the bath is concerned. As I told you, the clothing which you have ironed and kept well, and mopping and cleaning up, as I told you, you can use a soap-based detergent, and handling the baby, carrying the baby. Many people getting involved may not be appropriate. So, especially people who have gone out for work or who have gone out and who come back home need to make sure that they basically change their clothing or have a bath and be clean enough to handle the newborn. And even with the people at home, if you have been doing some other chores at home, you are better off washing your hand with soap and water, wipe dry with a clean towel, and then handle the baby. And so small tips like that which helps you to prevent the baby getting any cross infections, especially skin infections, which people tend to carry. There is a tendency for various people who come to see the newborn tend to kiss the baby repeatedly, and which we at the moment, I think social distancing has become a norm today. And so I think it is very important that you tend to prevent many people handling the baby and making sure that so the social norms of social distancing is maintained. We know that most of the mothers are breastfeeding the baby, and it's very important to make sure that the environment where the mother is comfortable for the mother, and that she could always breastfeed as and when needed in the first month, and then continue a regularized feeding, which basically may happen after the first 30 days of life. Wiping and mopping the floor with detergents, as I told you, is something which people tend to use a lot of strong detergents. And we personally prefer you to stick to soapy water, soap-based detergent, which is a mild form, which is not an irritant to the baby and the mother. Sometimes these strong detergents tend to induce a sneeze, a cough, maybe a nasal block and all that. And it's very important that you keep them clean. One more thing is, present day generation, we use a lot of air conditioning, and we have to make sure that the AC filters are washed and cleaned regularly so that there is no collection of dust which is circulating a lot. And avoid using dust collectors, I call them, the quilt, the flannel and things like that may tend to collect a lot of dust. And looking at the baby having to have a healthy lifestyle in the first few months of life at least, with the mother breastfeeding in toto 100%, we would prefer the mother to be careful with her diet. Most of the time there is no issue, but there are many occasions where mothers need to be a bit more careful with their diet, because there is enough information to say that what mothers eat and strong proteins and allergenic food may be going through their breast milk to the baby, and the baby may be finding it difficult. So when babies are whinging and whining a lot, they're looking a bit more red and very irritable after a feed, it's very important to look at what the mother is eating. And we always advise mothers to have a hypoallergenic diet. What we mean by hypoallergenic diet is less allergens in the food. It may be in the form of proteins, so sometimes avoidance of red meat, avoidance of dairy, avoidance of prawns, crabs and cuttlefish, things like that. So home-based food cooked well, and if I would say in Sinhala kirata, with a coconut milk-based diet, then reduce the spiciness and see how things are, and the babies do well. And looking back at health tips for personal hygiene, going from the newborn and when the babies become infants and preschoolers, the tendency to have cross-infection is high, especially when they start moving around and they're 1 year plus, they are going out to a daycare or preschool. The cross-infection chances are high. So if your baby is sick, in the sense having a cold or a cough, as parents, you must realize that you should not be infecting the other people too. So staying at home becomes a norm today. So if you are in your house and you don't give the infection to the others, then the others are fine. But when we tend to go out with our infection and when we infect the other children, other babies or the other preschoolers, then the infection spreads around. So as Sri Lankans, we are not used to having a social distance. We prefer to be together. We like to have, eat together, drink together, have a lifestyle together, even with the newborn, going out, meeting friends. So our lifestyle may have to change to prevent infections. And I think it's important that we realize the fact that the present day infections are much more vulnerable and more troublesome for the babies and for adults. So it is very important that to keep a social distance and prevent babies developing infections unnecessarily. Teaching the preschooler to wash hands regularly with soap and water and making sure that they don't handle things unnecessarily is something which has to happen at the home front itself. Training the preschooler to behave in a manner that prevents cross-infection is absolutely essential. So also looking at avoidance of handling unnecessary things. Children tend to run around, handle that, handle this. Maybe it's a wet surface, there may be something which the child may catch. So it's very important to see whether you can prevent them doing it. Then trying to be washing them with hand sanitizer, wiping them with hand sanitizers repeatedly. Because hand sanitizers on the long run, in excess may be a problem. Not in small amounts when you need to use it a few times a day. So training them to prevent handling unnecessary things might be more appropriate than to be using hand sanitizers more than 100 times a day. So washing with soap and water is much more safer, and also using a moisturizer to keep the skin more moist than dry. Training preschoolers to have a proper coughing etiquette, which even adults present day do not have. So using, as shown on many occasions in the social media today, that coughing and sneezing etiquette has to be taught to preschoolers so that they prevent themselves infecting others, then also getting infection from the others. And also the present norm of sharing food and drinks. I think it's very important looking at all the cross-infection the children tend to get. That is very important as much as possible to avoid sharing food and drinks. I know it becomes very, very cumbersome for parents to, advise preschoolers on what they should be doing and what they should not be doing. But I think on the long run, to prevent a catastrophe, it is very important that we look at it in such a manner, so that if a parent, there is a social function, the parents want to send some food, other eatables to the other children, so there can be a separate pack which can be distributed among the other children, and which does then the tendency for someone to, each of them to have a single piece may be much more appropriate. And so looking back at how we basically look after our newborns, infants and preschoolers in preventing cross-infections is absolutely essential. And we, at the present situation in our country, has made things a bit more difficult for the people, where we have to be indoors to prevent cross-infection. And I think it's very important that we also learn on the long run how we could prevent bringing infection to the home front. So people who go out for work, who go out for other social reasons, when they come back, washing their hands, making sure that they don't handle things unnecessarily is very important. When raw vegetable foodstuff are brought into the house, fruits and all that, whether they should be washed well with soapy water and cleaned before they are stored in place. And using your own collection of bags, like you can see the present day supermarkets, which they tend to advise shoppers to purchase bags which are reusable, so that decrease or zero use of plastic, and that matters a lot. And basically those things which help us to is something absolutely essential. So I need to look at also where when we buy the vegetables, fresh vegetables and fruits, and bring them into the home front, making sure they are washed and they are cleaned and they are stored, and also making sure that your common areas in your house are well mopped and cleaned, so that they can prevent the viruses and bacteria settling down. Dryness helps to prevent collection. So whatever area which are wet, which has to be mopped and cleaned with soapy water and kept dry, which is very important for you to prevent cross-infection. So, ladies and gentlemen, and young parents, we have given you what do I call it, a small resume of prevention of infection and health tips to prevent newborns and infants and children, plus at the home front, being cross-infected with various infections. So, personal hygiene matters. And I think it's very important for us to realize the fact that if we want to prevent cross-infection, our personal hygiene is an important factor. And with the present context, social distancing becomes absolutely essential. So with the availability of the social media, there a lot of work can be done without close contact. So social distancing doesn't become an issue for us to manage. And thank you very much. And we will see you all soon with another episode of this. Any questions can come on this, and we will be able to give you replies over the text. Thank you very much.